kudzidzisa vanhu kuti L4 L5 ndo pakanaka kuzasi kudonenga I'm off my reads water and
inonzi coda equine.
What's this procedure?
Most people know it as lumbar puncture. So it can also be called.
To help us demystify this myth, we have invited a renowned doctor. Hello guys, my name is Genius Chipfupa. I'm an aspiring neurosurgeon.
My name is Shawn. I'm also an aspiring neurosurgeon.
So mostly when a patient presents to the hospital with headaches, and usually persistent headaches, nausea, vomiting, and sometimes fitting, the doctor usually prescribes a very important diagnostic procedure. But most of the times, patients refuse this procedure. Is it because it kills? Is it because it's dangerous? Is it because doctors don't explain it very well?
They don't explain it.
Or is it because the relatives fear that munhu wedu anotifira? Doc, what's this procedure?
Well, most people know it as lumbar puncture, but it can also be called a spinal tap. So,
but the Shona name for that?
The Shona, it's got so many Shona names. Some of them, they sound like witchcraft. But the most common Shona name is Kutorwa Mvura
Kudonzwa msana. So to help us demystify this myth, we have invited a renowned doctor, Dr. Guts. Dr. Guts.
Hello guys, thank you for having me.
Thank you.
Walking data.
What do with data explosion? All right, Doc, tell us about lumbar puncture. Kutorwa Mvura msana. What is it?
All right, so in simpler terms, I would say a lumbar puncture is a point of care test that is both diagnostic and therapeutic, which is a procedure where we are simply drawing out cerebrospinal fluid from someone's spinal spaces. So it's more diagnostic and therapeutic. So most of the times we use it as a diagnostic test. Then sometimes we can use it as a therapeutic test when we want to relieve raised intracranial pressure.
Okay.
So no why my headaches and the likes.
Doc, maybe I think they found the rules of this podcast. No jargon, no big words. We know that my doctors, they really struggle. Short words. So by saying diagnostic, therapeutic, what are you even saying?
All right, so diagnostic tunakuona kuti chichuru like kuti munhu ari kurwara nei. So sometimes you can have munhu aita meningitis. So tunakuona kuti meningitis yake ndeye TB, ndeye cryptococcus, ndeye chi.
So we can cryptococcus.
So
cryptocurrency, Bitcoin type of thing.
So patinotora mvura, then we can then analyze mvura toona kuti what really is causing zviri kunzwa patient. Then kana tichiti therapeutic, it's now more of munhu ari kunzwa ma-symptoms ainawo sekuti headache, ari kurutsa, ari kuita sei, which is attributed to the raised intracranial pressure iri kuwanda mumusoro. So patiri kutora mvura, we are more of relieving the pressure and relieving the patient from the symptoms. That's the therapeutic side of it.
Okay, so when you talk about the therapeutic side, we know when most people present with meningitis, the first thing that the doctor thinks of is lumbar puncture. So is that the first line of treatment, or is it just kudongotora mvura?
No, so pane zvinhu zvakawanda zvinogona kukonzeresa meningitis. For example, you can have TB, you can have other opportunistic infections like cryptococcus and jargon. So for us to treat, we want to know what's the actual cause for the meningitis. Because there's no way you can then just treat blindly, not knowing TB, is it cryptococcus, is it viral, is it what? So the diagnostic side of it is for us to be able to then target our treatment and say, now trukurapa TB, trukurapa meningitis from a viral cause, or is it a fungal cause? Yes.
Okay.
But according to NHS, they said the refusal rate here, this procedure, lumbar puncture, the one that we are saying it's diagnostic, the one that we are saying it's therapeutic, is more of advantageous to us. They said there is a 30% refusal rate to it. And a local doctor, which is very popular on Twitter, Manonzi Dr. Ruende, wakaita an online research. And from that online research, 45% of the people, they voted that it's the doctor who doesn't explain the procedure so well. Then around 33% voted the procedure, it kills. Unotofa, and it and it 11% voted that it causes disability. Then 11% voted for other reasons. So Semuna are into the practice, Semuna are there in the world each and every day. Do you really see it? Are these figures real? Refusal rate when wachiramba this procedure?
So yeah, it's something that we experience on a daily basis. Mostly vanoramba for various reasons. So we have patient factors, we have doctor factors, like you said, but it's more on the patient side. So you'd find Kuti back then in the early 2000s when HIV was at its peak and we didn't really have my ARVs and the likes. And also people with HIV, they tend to get more opportunistic infections, and we didn't have the way you put up at those things. We didn't have treatment for those opportunistic infections. So when we had meningitis back then, yes, you could do a lumbar puncture and it would work as both therapeutic as well as diagnostic. So you'd be able to diagnose and you'd be able to relieve a pressure at that time. But you would see the result, this is cryptococcal meningitis, but there was no way of treating it. So people would then misattribute Kutorwa Mvura Yekumusana kwakaitwa patient iri muchipatara kwakamuuraya. But back then we didn't have the resources to treat, but now we are in a different era where things are now available. So people are associating past traumas with the current situation, which is not it. Right. And funny enough, unonzwa vanhu vachiti toda kumbofonera tete vari kumusha wangotaura kuti toita here, and you're waiting maybe 3-4 days kuti tete vazosvika, tete vazosvika munhu ari kuita worse. So it's both mostly patient factors. Then on the doctor side, to explain sometimes jargon is hard. So for you kuti uexplainere munhu kuti uda kutora mvura yekumusana yoshanda as both diagnostic and therapeutic, I don't want to say because what they are hindering on is zvekumashure kunzi tete vakambofa vatorwa mvura kana kuti chi. But explaining it we try, but it's hard for the general public to understand the jargon.
But Shawn, I think the other reason is even when these doctors are explaining it to us, and it then after wanotora our relative opinda nayo mukaroom, then that's where they do the procedure. So to us is also even tikaona munhu wedu afa after chatonziva ndechekuti akapinda murumu akaitwa lumbar puncture and ndosaka afa. I think it's very important for kuti vanhu they just have an imagination of a complex procedure inoitwa into the room. Vanhu vatombonzwisa kuti chii chiri kuitwa, inotorerwa nechekumusoro uku, inotorerwa direct from the brain here. Where exactly, doc? What happens exactly?
Alright, so patinotora mvura yekumusana, it's a sterile procedure. Tinotanga tatibvise utachiona. Tinotanga tatobvisa utachiona paganda kumusana, atishandisa betadine. Topa munhu chiveve kuti asanzwe marwadzo. So it's supposed to be painless. So tinopa munhu chiveve to identify patoda kuisa tsono yedu kuti tikwanise kutora mvura iyi. So mostly tinoona kuisa patient in 2 different positions. Umwe anogona kunge akarara neside, umwe anogona kunge akamira akahaga maoko nechikuchipfuwa akaisa chirepu kunokuku. And to identify patoda kuisa tsono yedu ndo patinenge taisa chiveve chacha. Then kwakutora tsono toisa nekumusana handiti patinoisira tsono kumusana spinal cord inenge yapera kumusoro
handipere panomva pabayiwa spinal cord yacho munhu ofa
stroke.
So spinal cord yemunhu inowanzoperera ndingangoti pane mabhonzo ekumusana handiti mabhonzo aya palumbar region anenge ari 5 handiti so bhonzo rekutanga pakati pebhonzo rekutanga nebhonzo rechiviri handiti pane disk riri ipapo handiti ndo panoperera spinal cord yemunhu. Isusu tichitora mvura yekumusana taakuenda pakati pebhonzo rechi4 nebhonzo rechi5 handiti ndo patiri kuisa nidhu yedu kuti tikwanise kutora mvura iyi. So spinal cord yemunhu inenge yaperera kumusoro. And malayers atinenge tichipinda achona it's basically basic things kuti apana munhu anokwanisa kuita any complication from that.
I think imwe problem ndeyekuti mugeneral public sitongoziva kuti munhu ane spinal cord zvakuti painoperera izvo anofungira handisisina spinal cord magumbo. So I think sometimes I think the best thing to approach this is to kugadzira maybe models hospitals model ke musana wemunhu then moratidza kuti kupinda so spinal cord yako ikona ikusoroko wopinza family chione futi kuti it's very non-invasive apana munhu ariko apana chichikupi hanzi kubaya spinal cord hanzi kubaya pfungwa kubaya pfungwa. Then I think the problem ndekuti when people achitorwa spinal tap or lumbar puncture imwe problem yekuti zvinhu zvikuitwa mashure patient haisitomboona zvinoitika because inoti kuti even vanhu achitorwa mabloods vanototya even though autoona the need
ichipinda muskin.
Now imagine you don't know what's happening.
You don't even know exactly.
So that adds to the fear. So I mean how can the medical world, how can we tackle that? Because the fear and kuti vanhu vachitiza vanhu
no kuti munhu aone it's hard because udauti musana wangu wakabuda kunze right but what can help is medical education and kuti tikwanise kudzidzisa vanhu in communities or sometimes I remember my last lumbar puncture that I did I showed someone a video that this is a basic thing you can have this done to you. It takes less than 5 minutes sotopera and it yes. So
doc seminini who have been in the worlds I've been to my hospitals for a long time now. I mean not long but for some time now. Makambone ere munhu anoti atorwa a lumbar puncture anofa afterwards?
No, I haven't. But when I was a student, we had a patient akamboramba, right? Who kutorwa mvura yekumusana. Then they wanted to wait for I think it was between Mashingo Gweru.
But why would one wachida confirmation yekumba kwabva futi kuya kuchipatara?
You know, chinonetsa in our culture is
hierarchy.
There's familiar hierarchy. So you'd find mwana maybe aya nembereki kuchipatara tandeti. Then mwana onzo pada kutorwa mvura yekumusana adaupa consent for maybe a father or a mother. Then at the back of her mind or his mind achaudza vanhu vari kumba zonzi kuchipatara zvanzi toda kutora mvura yekumusana. Then the next thing is anonzi ngazvisaitwe. So iye ane kakutya kekuti anzi if anything happens it's on you. So ndiwo waita kuti zviitike but munhu andiri kutaura uyu akaita I think we had a week with them on the ward. Aitotaura they were okay initially but they kept on deteriorating because they were not getting treatment and achimirira confirmation. Then when they then gave confirmation that was too late. Then maybe toita lumbar puncture today then someone succumbs the next day. Now you are now attributing what we did to saying those were Kunouraya munhu but no Kunouraya munhu utachiona urichi
wa progressa.
I think because I think the problem when you go to patient mira I'm my headaches so everyone gets headaches or mira but I've got my migraines right or mira until maybe akuita ma convulsions like seizures akugwina ozouya manje then muchi makanobaya inkatsono kenyu next day munomuka akaoma. I think people need to be educated kuti if you present with symptoms akadongoita meningitis yamamotaura manya kuhospital. It's early. It's better kuti wawanikwe early then pane kuti because you are late tokubaya uvakita wafa zvako they start kublame on mabvisire mvura yacho what anoti totopaita sei baba.
Yeah, I think kudzidzisa vanhu is the way forward, and it's not something chinenge chakaoma, but going into communities and telling vanhu kuti if you present with so and so symptoms, for example the headaches you are talking about, they get worse in the morning, anorutsa makuseni, they get visual problems, mutsipa unotaka kuomarara, and those are the kind of things you need to report to the hospital early. But you then see munhu anozouya dzimwe nguva akuti ndane 2 weeks ndine headache, ndakandichirutsa, and so you can imagine the progression that has happened over that time. And the brain is a very delicate organ yekuti haidi utachiona iwoyo kuti unge uita sei uchikanganisa. Ndo pamunozoona munhu ane macomplications akaita sekuzogwina kwamakutaura, and so kudzidzisa vanhu would be a good way, and zvinobatsira kuti vakurumidze kuita sei kuti vauye kuchipatara vobatsirwa pachine nguva.
Then also doc, I think to show that this is a very important myth iri kuuraya vanhu vakawanda, zvisiri muma-textbooks, zvisiri muma-books or what, just on average I understand kuti munoshanda paparirinyatwa, is it how many requests anoitwa lumbar puncture just on average pazuva?
Well, zvinodependa noti uri kushandira kumaward api, and but now I use myself as an example. Right now I'm doing internal medicine, and on our last core day 4 or 5 days back, takaita about 4 or 5 patients vataida kuita lumbar punctures for different reasons. 3 of them engeri yekuda kukwanisa kuona kuti havana here utachiona hwemeningitis. The other one, it's more of taida kuona kuti haana another disease inokanganisa tsinga dzemuviri, and that's another way of doing lumbar punctures yekudiagnose izvozvo. And of the 4, I told you it's about 4 or 5 days ago, the only one watataita lumbar puncture is today is which 400 pesira kutaura uyu. Vamwe umwe wacho na admitted patient, explain kuti tautora mvura yekumusana zvazofamba, so she's newly diagnosed HIV, aita TB, ndobva abatwa futi cryptococcus iri muropa, yanga isati, so inotangira muropa inozopedzisira yasvika kupfungwa. So now tauda kutarisa kuti haina here kusvika kupfungwa, tauda kuita chi, tauda kuita lumbar puncture, and unoti ndakunotora tsamba yemubhedha ndokupedzisira kuona kwatakaita
imhanye neupenyu
arwa pasi, you see. So now we have 2. The other 2 you're still waiting for consent yekuti ningazo chakati.
But doc, ndiri kunyatsaona kuti munhu yaanofa ndikasamita lumbar puncture as a doctor, and munhu yaakarara and is not even in a position yekuti anondikurira kurunzi ndakuda kumutora. Can I not just take that opportunity then ndotora lumbar puncture yangu zvisina neconsent yake? Just to save.
No, like yeah, kutoseva munhu upenyu ndinenge ndichida, but ethically it's not right.
And akazobva afa futi.
And pane zvazotoitika manje. Nosera ndakumakanso ndakunzi kochi chakazoitika. Mama akuite futi munhu asina kupa consent. And I think chisikanyachonzwiswe nevanhu vakawanda is hakuna munhu anobva kumba achida kunouraya munhu. So munhu aende kubasa kuchipatara, it means they want to help. So hapana panichazoita chinhu chandoziva kuti toda kuuraya munhu when I want to help. I think the general public ikazoona like that, it's better.
Doctors are there to help.
We are there to help people. We are there to save lives, and we are not there to kill people. Ndezvaiuraya tangade takamira kuzviita. Takade tisingatombobati musana munhu.
That's honestly true. So Shawn, pana paralyzwa nawo dzakati wandei. The first one was nawo yekuti there is pakapinda cryptococcal neoformans yaiuraya vanhu. I'm a neurosurgeon. So payakapinda, it was a confirmation test yekuti waakufa hanzi nadhoko waingopiwa morphine then woenda kumbonzi nyaradzai marwadzo handiti then vanhu saka it's more of like a past trauma thing yekuti takakwadzwa kudhara then it's being passed from generation to generation. Probably that's the reason why tauya nayo PodMyth to what
to poke holes and drain the drama.
Exactly. So there's also the issue yaraiswa nadhoko yekuti we are lacking health education kudzidzisa vanhu kuti ayo L4 L5 ndo pakanaka apa nditi then kuzasi kudhoka I think anenge more of my reads in water and
inonzi koda equine.
Saka there's no way you can actually kunonzi kuti paungabaya a reed iri mumvura because there is the law of buoyancy ndakupinza physics the law of buoyancy you cannot pierce a reed iri dangling in water and because inongomova ichimova imova. It's not kuti kuzasuku ichiri rigid ichiri that solid yekuti you can pierce it. Umbotuzere 3 malayers.
Yeah, so the spinal cord nepfungwa dzine malayers or coverings yakandete. So layer kunze rinonzi jura meta. You just think of a jura which cover imba yemunhu. Then the next layer is your arachnoid meta from the word spider. Arachnoid. Then the last layer is pia meta, though inengeri closely investing the spine as well as the brain. Then isusu the space at tinoda is the subarachnoid space. Basically ndo space iri between layer and ataura 2 ne layer 3. Ndo layer munofambira mvura yandiri kutaura iyi. So ndo matinosvitsa needle yedu mvura yobva yabuda.
But even though my doctors turungodaidzira lumbar puncture yakanaka isusu toda
kuita kwacho
kuita and even kuitwa.
Personally, if I'm to get to that situation, I think I would want to get one done because I know since ninge vchindi batsira and then on the comfort side yokuita and I think most people may not be comfortable but once you do 1 or 2 unopesera wajaira and because usually in the medical field if you can see one thing being done the next time you can say I want to do that because you see it's a simple procedure just like taking blood and I
think ndakatombona podcast yaiti kutora ropa kwakaoma than the lumbar puncture.
That's very true. Because kutora ropa unombopotsa tsinga dzemunhu hadzisi kuoneka apa uroziva ndirungoenda apa ndonoisa needle yangu mvura yobuda.
Doc, tell us about your first lumbar puncture experience. Honestly,
she's alive. She actually went to UK to get further treatment for other things.
Okay.
So it's a patient Angari. He had been in and out of the hospital, had a neurological condition, and I think this was now the 4th or 5th time Achwana a lumbar puncture. So we admitted this patient just for us to be able to do a lumbar puncture and see a worsening of the condition that she had. And it was, I think it took me 10 minutes the first time. It took me 10 minutes. But sometimes you'll be nervous, you'll be like, what if this happens? But I realized it's not that hard. And all you then just need to do is just make sure that needle yako yapinda chaipo. And unengo wakwanisa ku-identify ma-landmarks ako pamwiri wemunhu wekuti ndikabata apa neapa ndikasanganisa maoko angu pandiri kunoisa kadhimpu paskin yemunhu ndipo pandasvika and ndo pandiri kunoisa needle yangu iite se chinopinda. She's still alive.
All right, Doc, there's another thing, Shawn. I think it's this lumbar puncture procedure, lumbar puncture type of thing. It is very much important, usually when we are diagnosing people living with HIV and AIDS. Yeah. Doc, why is it?
For one utachiona we HIV and AIDS, mwiri wavo I was able to fight my infections and it's one of my opportunistic infections. Dzimwe dzenguva dzekuti maybe they have defaulted art kana kuti vakanonokera kutanga mushonga or munhu ane HIV asati apa mushonga ko asiya mushonga, so mwiri wake was able to fight my infections, so anoita my opportunistic infections. So those people ndo vanopesera vaita zvinhu zvakaita sana meningitis yabva ku-TB yabva ku-cryptococcus. As it's not true to say lumbar puncture ingori yevanhu vane HIV.
Yeah.
It's not true.
Yeah.
Because vanhu vakawanda muchipatara dzimwe nguva anoona kuuya ofunga kuti ndakutora mvura yekumusana hama dzangu dzakufunga kuti
exactly. I think it's a contributing factor.
So vanhu vanenge vachitya stigma from the society and people, but lumbar puncture haisingori hayo yekuti vanhu vane HIV. There is a whole array of zvirwere zvinokanganisa tsinga dzemuviri kuti tivatokwanisa kuti tizvibate tinenge da kutora mvura iyi titarise kuti hazvisiri izvozvo here. Say the other person vanataura wechifo akabvuma uyu. It turned out to be izvozvo.
Sure.
Yeah. So can we say kuti munhu akashaya lumbar puncture what are the ratios in terms of survival?
In terms of survival, I may not have actual ratios or rates, but I'll give an example of a girl. Akabva in one of the rural areas in Zimbabwe. The parents were in South Africa, so I got an agogo kunoku. So you admit, so it's the older generation. So one thing experience
the trauma.
So takaita I think 2-3 weeks with this girl. Initially akatombotanga achitombotaura, then got worse, started crying, aichema manheru, that's the pain is unbearable. And then we want to see kuti the infection infection iri mubrain, yes, but chii chakonzeresa handiti mbuya vomboti ngatimbomirirai amai vosvika voti nababa maybe tidichi ari separate. So mwana ane varidzi, ngativhunzei baba mhuri yekwababa vomboti chimbomirai vozouya. Then 2 weeks down the line mozobvuma kuti ngatichitai lumbar puncture yayo. And it's very easy kuita lumbar puncture pane munhu ari very cooperative sekugara kwatakangoita like this. Handiti but now you can imagine someone anenge adeteriorata akunatsorwara. Handiti now you see kuti this person is towards kuti if you don't do something you're not going to help the patient. But tinoda kuzotora mvura yaya, it's too late. Yes, tichatora mvura toendesa kulab because toda the result yekulab. And so kulab kwekwe yonotariswa kunzi haisi TB, haisi umwe utachiona here uri konzera meningitis E. Then mochiona the result maybe comes out maybe in 8 to 24 hours. The next day maybe amsisina munhu.
Saka ndingwe kutaura mango confirma zvekunyora pa death certificate.
No, chinenge chakauraya munhu and it is the delay. And you had someone for 2 weeks whom we could have helped and said utachiona uyu nde wakati, kana iri TB mshonga we TB we have, kana iri crypto mshonga wapo, and kana iri any other form of meningitis mshonga iripo, then we can target that and treat. But now munhu akutakura utachiona for a very long time. And zvanamotaura pfungwa chinhu chiri very delicate. So that fluid is the only fluid yatokwanisa kuwana iri closest to tell us what's happening mupfungwa. Ropa hari mubofe rakatudza because ropa haritosviki panenge paine
there's that
barrier. So my chemicals ari so my chemicals atinenge tinawo anenge ari muenvironment yebrain neanenge ari kuropa anenge akatosiyana. So kuti nditore ropa ndokwanisa kuti ndidiagnose, it's impossible. So I have to take the fluid kuti ndikwanise kuti ase kuona what's happening in the brain.
Doc, thank you very much for joining us in demystifying this myth. Time zedu zapera. 2 hours zaisvika para.
Yeah, we can spend a lot of time talking about this.
But in closing, we're given a scenario. We've got an old lady, arongane muzukuru wake. Example yamatudze. How do we convey this message? Kune machembe ndo kuti ndo cannot experience that zvakaita kana that period and don't need that trauma. And obviously because of Shawn we are taught to pass on the knowledge to the next generation. So how best can we target that generation?
Before Doc mira ndiku plus na dog to the same
dog genius.
So I think it's really hard to teach an old dog new trick.
Yeah.
Saka go ngatisiyane now.
Oh.
And tikatanga kubata ma-ECD vana vachikura, this is the spinal cord and it combined science it's integrated science and kana kuri kuprimary tiri kuisa ma-components of vana spinal cord in there, tiri kuadropera. Why? Because vana chandoziva pavanosvika umba vanosvika vachiti gogo nhasi tadzidza zvakati, lumbar puncture is a safe procedure. Because ndozvo vanongonyoreswa the topic, lumbar puncture is a safe procedure, then chakuimbwa gogo. Doc, maybe you can demystify it further.
I think kuvanhu vari kumba mostly vakura vaka-experience nguva yekuti we didn't have medication and vanhu vaizofa later on. I think the best thing is, so we can teach an old dog new tricks, but I want to say kuti machiremba haurai firstly. So ukaona munhu ari kuinsista, this is someone who wants to help. So this is a safe procedure kuti we want to help and save a life, and kata save a life, we are saving basically your relative. Apana pandru kuya kumunhu and say I'm not doing it. Okay, I'm doing it for me because I also have satisfaction at the end of the day. But toda kuseva upenyu and toda kuraramisa hama dzenyu as well. And that is why virata yakona kuti vambopinda vachiona vichiitwa. But you have to protect them, and sometimes you don't have to have them come in contact with fluids and everything. But it's a very safe procedure. Apana nofa. And it's a very, very important test or procedure yekuti inokwanisa kutibatsira semachiremba kuti tione kuti chicha tiri kurapa chichi kurwara nepatient and we get a way forward.
Shawn, what are your last words?
My last words is usarambe kupaiwa kusana. Vuma kupaiwa kusana.
I think it's in a missing words. Kobanga.
I think my closing words would be that let's not use the old ways of trying to solve the current situation.
But Doc, history portrays future events.
Not in this.
No, wait. You say, I think another point is before the advent of CT scans, before we had that Hansberg guy CT, it used to also be a dangerous procedure. If usingakwanise ku rule out kuti munhu haanere a lesion or bundu riri kukura musoro rinokwanisa kuzokanganisa matora mvura iya. But now if you suspect that munhu anongoitwa CT scan moona kuti musoro muri clear, motongotora mvura yenyu.
All right. Yeah. Thank you very much. All right.
Do you have any closing words, Dr. Genius?
Please subscribe. All right. Before we go, Dr. Guts, when his podcast, you check in the comments to just the link. He is an anatomy tutor.
Working data.
Yeah, just working data. One of my videos about anatomy, how to pass, how to nail, or a crypto. All right. All right. Thank you very much for watching this podcast. If it's your first time here, you can scroll down our YouTube channel, then check. We have episode 1 and episode 2. Episode 1 was on gender-based violence and sex determination. Episode 2 was on antimicrobial AMR. And antibiotics are not a treat to flu. All right. Thank you very much.